wanted to give a little background about who I am. I am a veterinarian. I graduated from the University of Illinois in 1995. I was in general practice, solely small animal for the first 17 years of my career, and then I slowly started becoming more interested in looking at alternate ways that I could improve quality of life for my patients, both with behavior and mobility, because these were the two areas I felt I was lacking in ability to help them. If they were having lameness or trouble getting up, that would often be the end point for my patients. So I started looking into the physical modalities and studied veterinary spinal manipulation therapy through the Healing Oasis chiropractic. And then I got certified in acupressure through Tallgrass Animal Acupressure Institute. And with that, I became really focused on, I've got the manual therapies, but I want to learn how to improve mobility and function now that I've done some of the manual work. So I wanted to study rehab, and I went to the Canine Rehab Institute and got my CCRT, and has led me down this path of migrating from being a general practitioner, applying rehab and chiropractic, to full-time standalone rehab practice here in Pacifica. And I love it. I have a number of wonderful clients that come for their older pets for pain management. I have a number of clients being referred by surgeons and neurologists for post-op rehab, or when they can no longer help them surgically, neuro rehab, or for degenerative conditions that are progressive. And so when I started my practice, I started off with a laser and an underwater treadmill, some of the big, commonly used modalities, in addition to my hands and in addition to therapeutic exercise techniques that I've learned. But what I soon started to realize was that laser and my hands could only do so much for some of the more fibrotic tissue. And I had my first case of a German Shepherd with fibrotic myopathy. And he had seen the surgeon, and the surgeon didn't find anything with his stifle joint or his hips or his spine. He saw the neurologist. They all cleared him of any underlying pathology, but he had an abnormal gait. And when he came to see me, it was very clearly the beginning of German Shepherd fibrotic myopathy. His gracilis was tight, much tighter on the right leg than the left, but both were tight, and his semitendinosus muscles. So quickly, I recognized the pattern, and I contacted one of my colleagues in the East Bay in Oakland, who had worked at the Animal Medical Center for quite some time, Dr. Jennifer Damasio. And I asked her, what did you do at the AMC for these fibrotic myopathy cases? And she said, hands down, the most helpful treatment was Shockwave. So I said, okay, do you have it in Oakland? And she said, oh, no, we don't have it. And I started to check around, and it turned out that nobody had it in this area. A handful of people did. And then I started to research more about Shockwave, the difference between focused Shockwave and radial Shockwave, high intensity, low intensity. It was all new to me because we had heard about it at Canine Rehab Institute in our training. But I had kind of dismissed it as a modality that I probably wouldn't get, that I would probably get ultrasound, but not Shockwave, because I had kind of been told that it was, A, it was very painful for the patient, B, that it was very loud, and those two factors meant that you had to sedate the patient in order to do the treatment. And those were the two main drawbacks for me, really. And C, I thought, well, I can't afford to pay so much for a piece of equipment that I might use a handful of times. What I've learned since then is that it doesn't have to be that kind of session. It can be low intensity, it's not loud, it's not painful, it can be an outpatient procedure, and it is with my patients, and I get tremendous results. It would be easier to tell you which cases I don't use it in when it's contraindicated as opposed to how to use it, because I use it in almost all of my patients. Primarily treating myofascial pain and osteoarthritis pain. So I had the PiezoWave 2 demonstration. I lined up, they said bring in a couple of patients so we could show you, and I lined up patients back to back every half hour for like probably 11 or 12 patients. And every single one of them at the end, the next day reported to me that their dog or their cat, we treated one cat, felt so much better. They wanted to know, when was I getting my machine and when could they sign up for more therapy? I also had a demonstration on myself, on my own myofascial pain, by Joe Lemon, a human rep. We had both Joes here, and it was incredible. The immediate relief of pain and tension in my neck. I like a lot of overusers of the computer and doing the work we do, looking down a lot. I created a lot of overuse strain of my upper trapezius, my deltoids, and I had some pretty nasty trigger points in my neck and loss of range of motion. And Joe just did one treatment to demonstrate what it would feel like, which was really important to me so that I would know how it felt in my patient. But also the relief afterwards was so profound and so immediate. I thought, oh my God, even if I get this machine just to use on myself, I'm getting it. So that's how I progressed. I also did a little more due diligence. I looked into getting the an electrohydraulic model in for a test trial. But when I talked to folks who had the I call it the PiezoWave, I'm a PiezoWave vet, too, they also told me, and I learned that you don't have to replace the parts as often. And I had no idea that with the electrohydraulic, I would have to replace the trodes every like 15,000 pulses practically. And my average patient, just to give you an idea, my average patient I might treat for 10 to 15,000 pulses per patient. A half hour barely covers the amount of time if I'm covering the whole dog. Sometimes that my patients have so much myofascial pain from compensation. Sometimes they can be so chronic, the cases, that we need multiple treatments, but I can always see the immediate benefit and effect. So these are the three big things that I think this machine gives me that my laser really doesn't, and that electrical stim, e-stim doesn't, and e-stim acupuncture doesn't. And I've had all these modalities on myself, and I can say that this also provides me with the most instant pain relief. So it's acute pain relief, and there's a number of studies out there looking at the reasons why, whether it's due to competition at the dorsal root ganglion and inhibiting the descending pain pathways, or stimulation of the A delta and blocking the C fiber transmission, affecting substance P and other chemicals in the inflammatory process to relieve inflammation, and even mechanical compression. This is what I found most interesting, the mechanical tapping of the sound wave itself, tapping on the very small nociceptive fibers, the very unmyelinated superficial fibers, could actually be kind of basically depolarized and not able to regroup themselves, not able to start firing again. And so it was an immediate relief of myofascial pain and tension. And I wanted that for my patients, and I see that in a number of my patients. So pain relief is the number one thing I'm using this for. It also softens tissue immediately. If the muscles are tense, they're no longer tense when you relieve the pain, and I can stretch them better. I can do my manual therapy better. The patient relaxes better, right, Donna? The patient relaxes, and literally I'll go from having a shaking, quaking dachshund with the eyes bulging, muscle fasciculation as I palpate up the spine, and dropping in the center when I get the T10, and then halfway through the treatment, they give an exhale, they sigh, they put their head down, and then they stretch out like a rubber band, and no more muscle fasciculation by the end of my treatment. The clients and I can both see it, the dog feels it, and it's a great thing. The second reason that one might want to use this machine would be, a big reason would be to break up tissue, that's scar tissue, calcified tendons, ligaments, myofascial trigger points or knots within the muscle. It's a really great tool. I know acupuncture needles are great for myofascial trigger points as well, but I find that treating with Shockwave, I'm not just treating locally in the trigger point, but I'm fanning through the whole muscle belly, and I'm getting the fibers and the whole fiber, where the trigger point is maybe just a bunched up collection of fibers at a motor segment of the muscle. I'm treating the whole tissue, I'm treating all the fascia, all the superficial nerves that are in that area, the layers of muscle, depending on how deep I go with my gel pad. So breaking up tissue, blocking pain, and then lastly, another big biological effect, when you look at the literature, is stimulating regeneration of tissue. It jumpstarts the growth factors coming in to build more fibroblasts, collagen stimulation, chondrocyte and osteogenesis, so bone remodeling, cartilage repair, fibroblast production. So it's great for those non-union fractures. It's great for comminuted fractures. If you're a surgeon and you're treating a patient and you're putting Humpty Dumpty back together again, and there's a lot of soft tissue trauma and fragments, you know, I liken it to, I think of it as debriding the bone without getting the scalpel blade into the tissue. The little pulses, the shock waves themselves mechanically are tapping the tissue and causing that little microvascular trauma.